Health has always been a top priority concern for everyone. However, it is now one sector that has emerged as the most important significant industry after the pandemic struck the worldwide. Dealing with healthcare crisis, finding solutions to interviewing questions, preparing blueprints for the future, knowledge sharing among the countries, many more catapulted the gravity of an emerging topic that is data analytics. That's what we are going to discuss today. Big data tools, as we know, have played increasingly significant roles in the healthcare, and worldwide is increasingly being used as a clinical decision making. There is a growing demand for patient-centric or value-based medical care, which has led to a considerable shift towards predictive and preventive measures with regard to public health. Data makes this possible. So we have very, very important points to discuss, which all the participants, panelists will be discussing here. So I will not be dwelling on more details, since we have a wonderfully competent team to discuss at length the nature of and scope of this new body of language, which will certainly have far-reaching impact on the healthcare industry. And I am sure there will be lots of takeaways for the participants also from this. So we have today with us Vandhana Rajendran, Director Healthcare, Deloitte. And she has over 17 years of experience in managing consultancy across diverse industry, currently focused on transformative projects in the healthcare sector. Vandhana's areas of specialization includes patient wellness in journey management, interoperability of healthcare records, and healthcare analysis, a very important sector, especially for the topic as well as for the industry also. Welcome to you. Dr. Mohan, he's neurologist, and he's also a mobile app developer and tech entrepreneur, and with a demonstrated history of working with hospitals and healthcare industry and developing top-ranking mobile apps. He's a machine learning enthusiast, independent app developer. Some of the apps developed by him are the most common Indian train apps. Most of you might have been using that. And Courier Tracker, BHM app, MCare app. Welcome to you, Dr. Mohan Noone, to be with us today. We have Gopi Koteeswaran with us. He's alumnus of IIT Madras, IIM Calcutta, IIM Switzerland, and Harvard Business School. He's CEO of Latent Analytics since 2014. Latent Analytics, as you know, is one of the world's largest and fast-growing data analytics firms. So we have the right person for this session. Welcome to you, Gopi Koteeswaran. And we have Amrita George here with us as assistant professor in the Robinson College of Business at Georgia State University. Before joining academia, she is in the area of academia. Before that, she worked in the IT industry with her experience spanning business analytics, project management, and consulting across multiple business domains. So we have four specialized persons who can talk on the various four important verticals on this area. So what we will be trying to do is talk on the important topics, so that there will be lots of takeaways for you to give you a clear understanding about the concept and the fundamentals of this. Can we start with Vandhana, please? Can you give an overall perspective of this data analytics, the importance of big data in healthcare, the possibilities, challenges, trends, and the emerging opportunities? And as you know, collection of healthcare data and seamless data exchange and interoperability are something that we are discussing. So you can start this discussion with some valuable inputs on that.
Thank you, Mr. Ajayan. So I will start off with a couple of statistics, right? In terms of the VC investment in healthcare, India stands fourth in the world, right? And the amount of investment in the past 5 years has been close to $4.4 billion. And the Indian health tech market, the health analytics market itself, is growing at a rate of 20% year on year, right? And it's supposed to reach close to 47 billion Indian rupees, right? So where do startups in Kerala play? right? If you want to capture data from a rural place and your app only speaks English, how do you then capture that data? Then comes connectivity, right? If your app requires very heavy, very heavy storage, let's say, then how do you install it in a phone of even a doctor in a PHC may not have like a high-end phone. So in that limited infrastructure, how do you capture data? Can you have models where the data can be automatically captured? So in the previous panel, we heard reluctance from doctors saying that, we want to do caregiving. We don't want to do data capture. But today, there are actually technologies which can, translate the very bad handwriting of doctors and translate it into medical records, right? And then you just need somebody to look over it and ensure that it is accurate. That is the way in which the future is evolving, and that is where we should focus on playing. Because yes, it's very easy to play in the markets abroad where things are more streamlined. But we have to remember that India has the second largest population in the world, right? And that's the market size. Nobody remains healthy from birth to death, right? So everybody is a patient, and this is the market that we should focus on.
Thank you very much. To continue, doctor, since you are in the, you are practicing, you are working in the hospital, can you brief about the complexity of data capture, interoperability between hospitals, and how it has benefited you, and how to take it forward?
Yeah, thank you. Over the past few years, my hospital, where I work in Dr. Memorial Hospital in India, so yeah, there are still, we are not 100% on board. There are still people who prefer to write on paper. So right from that, there is a challenge. Because unless you capture it, there's no further data to analyze. If you scan the sheet and store it, it's very difficult to generate any intelligence out of that kind of data. So methods we have used in that level is, of course, over time, it automatically happens to some extent. Then enabling easier input tools like mobile apps and voice input. Like even if you have an Android, it has the Google voice typing option. So you encourage people to use that to capture small notes, discharge summaries, they can type it using the voice input. And it comes as, it's fairly good in recognizing even medical terms, the default Google capture. There are specialized tools for that also, which are more expensive. And then we have the data which is stored in our hospital. When we scale out like to more national, regional levels, then the question of all this interoperability and having a common platform and pushing towards that, which is what will be required if you need large scale intelligence, because if you train data on a particular set and your model may not work in another setup, so it needs to be as representative of the market as possible. So that we need to have a platform which right now it's not there, but like Ajayan Bharat government level incentive might come in, and then there are a lot of opportunity for startups to enable hospitals to be able to meet that standard. Like for us to be able to be part of a national platform, there may be a lot of interoperability concerns, a lot of how to push the data, how to store the data. I think somebody could also touch on that aspect later on, how this data is being stored, or how in the future it might be stored, because it's a huge challenge, like the second largest population in India. So that's a few points I wanted to mention.
Okay, we will come back to you. See, India being considering the population, the size, and capturing data, to what extent you should have the data, and what should be the size of the data, and how to do it, how to the ethics and the reasonableness of collecting the data, and how it can be totally made between state and central schemes.
So right now, even if you want to buy coconuts, right, people are accepting Phone Pay and Google Pay, right? That wasn't the case 5 years ago, right? That's going to happen to healthcare, right? Whether we like it or not, some people might say it'll take 10 years. Some people might say it's going to take 5 years, or they really are. So I'm not talking about the time frames now, because as startups here, you want to see inflection points. So when that technology comes in, when you have the API introduced in healthcare, just like the way it's been introduced in the financial sector, there will be opportunities for startups. And nobody's thinking about it right now. It looks like very future. But our own Kerala Digital Health Mission head, his second point was about Ayushman Bharat Digital Mission, right? So people are thinking about it, working on it. The best brains in the country are working on it. As startups, the way we need to think about it is it's going to happen. If not today, if not tomorrow, let's say it happens by 2030. What that means is each one of us will have a health ID. Each doctor will have a doctor ID. And the newer services, everything that my colleague Vandhana was talking about, right? How you capture 360-degree data on patients, all that will be available sooner than later. And how can the startups use this? That will be the big question. And the privacy elements of it will evolve, right? They will evolve because it's a new field. So there will be a controversy, there will be a scandal based on which things will change. But what I believe is that the doctors who will be the lead in deciding what will be done, what cannot be done, they will take the right calls, and we should trust the system, and it will be an evolving system. And we will take best practices from other countries, but I think we have an opportunity to leapfrog the developed countries because of this API that we are planning to introduce in India. It might take 3 years, 5 years, or even 10 years, but when it comes in, it's going to be one of the best in the world. I mean, so I'm very optimistic about it. It will happen. So with that, I want to address the startups. What can they do? See, the thing is this. There are some cool stuff that's happening on the app front and on, getting your drugs at home faster. Those need to be done. They bring in efficiencies in the market. Do it, right? Those are the easy wins. But at some point, we'll have to come up with breakthrough technologies which help the doctors in their clinical decision support systems, right? So, for instance, if you can detect Parkinson's early using brain MRIs, right? If you have a startup that can do it, you're going to be better than the ones coming out of Israel and the Bay Area today, because you're going to have more data sets. You're going to have brilliant doctors supporting you. So if you solve this problem, you're going to be a unicorn, right? So go after those problems. As startups, aim high. Go after problems that nobody's solved in the world. It's tougher, but those problems are still available. I'm personally sick and tired of these solutions coming from Israel again and again. I think it should come from Kerala, right? You guys should crack the code on this. It should come from India. So there are a few problems like this. And our set of people that we have can help you define these problems. But as startups, you should start thinking about it. Like, for instance, two patients have the same situation right now, but one is going to degenerate faster. That can be predicted using genetics plus various other things. If you can predict it and advise the surgeon to intervene on this patient instead of the other patient, you are providing enormous service to the surgeon, right? So these are areas which are still available that we can crack the code on. Remote monitoring during COVID, US has picked it up in a big way. So some hospitals are monitoring for 10 other hospitals that are in different states. Things of that nature are fairly easy for India. Those are places where startups can help out. I'm just pointing out some areas where startups can make a big difference, because these are...
That's very important.
These are areas, billing for instance. So simple stuff, let's say I'm getting discharged at 12 and I go to the nurse standing next to me and say, how much is this? Somebody comes to me and says, it's roughly about 50,000 rupees. And 1 hour later, I get the actual bill. It's 62,000 rupees, right? Not a big variation, but for me, I've just collected 50,000 rupees. Now you're asking for 12,000 more. Right? So simple problem which analytics can help solve. It's not such a big deal. Just collect the data, make sure the first information you give the patient is the information that they need. So simple things like this can go a big way in helping hospitals becoming more patient-centric, right? So think about, to the startups, this is what I would say.
Data, legal aspects of these, regulatory aspects of it, because that's also very important, if you can, please.
Okay, so first of all, I just want to let you know that we have been blessed with COVID in the sense that it pushed the second largest population towards digitization, which means we have a group of people who are ready to give us data. So getting data is not the challenge. The challenge that every healthcare organization face is having their people, meaning their workers or their members in the organization, use this data effectively. Okay, and I teach in Georgia State. I teach in the health informatics program there. And so yesterday night I just did a Google search, and the Google search was for a health informatics program in India. I did not get any, to be honest. Okay, and it kept me wondering. We have so many nurses, we have so many doctors being churned out every year. Why don't we have an informatics program which can bring in more and more talent towards this entire new area that's emerging? It's a very good opportunity here because we're creating employment opportunities for the future. We're training our nurses and our doctors to be the next generation of health practitioners who can even set the example on world stage. Okay, we have such a large pool, okay, of talent, and we are not capitalizing on this opportunity. That is what it means. Now, is this something that is a showstopper? No, it is doable. It's just that institutions have to start incorporating these programs, like a health informatics program or a nursing informatics program. You can start at that level. Now, when it comes to entrepreneurship, that was also another thing that I looked. In our universities, we teach students and we put them through placements. We don't have an entrepreneurship cell that promotes entrepreneurship talent. We should be starting that at the college level or in the university level, because that is where we can start with new startups coming into the play. Okay? And to be frank, India is not far behind. We have the youngest population in the world. We have a very dynamic population. And I would say one of the biggest strengths of our current population is that they are go-getters who are ready to do what it needs to happen to be the leaders in the digital world. So I would say let's capitalize on that.
Okay.
Now, from a health regulatory standpoint, before I go into that, here's a simple question to all the audience here. How many of you would open your phone right now, open the photos that are there, and share it to a stranger in this room? Please raise your hands. I've got only one person who said that they will share their photos to a stranger in this room. That means you are very much concerned about your privacy and your confidentiality of your data. It is normal, okay? We have a law that protects you. It's the IT Act 2000, Section 43 and 65 that protects your privacy and confidentiality. No one can share your data without your consent, without your permission. I can be a caregiver for my dad or my mother, but I cannot share their data without it can collect it. They are just keepers of data. Now, the question comes about storage of this data. How do you store such massive amounts of data when you get that? I think that's where blockchain technology comes in play, because blockchain's idea is that distributed data storage where the person itself owns that data and then eventually can release it based on their consent. Okay? So I think that's where you can leverage the new technologies to be able to do that. Then when it comes to, for government purposes, they need data, they have to aggregate the data. The best way is that hospitals can aggregate it and send it, because some initiatives that come out, like for example, if you want to reduce obesity, you need data to drive that initiative. So you still need aggregated level data being sent, but you should do it using the standard frameworks that are there so that you protect the privacy and confidentiality that is needed with that data.
Thank you. See, when we are discussing just one more point, we are talking about hospitals and data and patients. I want to know how it is relevant for pharma industry, because that's also in the health sector. How it is going to be taken by them, how things will move, what the future in that, whether there will be any synchronization between the hospital data and the pharma data, or because they also require for their research and all those things. What can be the take on that?
Good question. will be jointly done, but for specific purposes. If you're doing clinical studies on a specific purpose, then there will be a discussion between the pharma industry and the hospitals, and then they would share the data for greater good. So it's the concern of me owning the data. If somebody doesn't even want to share their photographs with others, then people will hesitate to share their personal data. But there are guidelines on what can be shared, and for clinical purposes that can be used. But those guidelines, and there will be an ethical committee watching over this, right? So the current doctors, the thought leaders will be there overseeing every one of this, and I do know that the ethical committees are extremely strict. I mean, I'm working with IIT Madras on a project where we have the publications, we just want to publish it, but our ethical committee is not allowing it because even though the hospital said they've got consent, the ethical committee said that consent is not enough, right? So I do feel that we have our thought leaders who will make sure that companies are not violating. But we need to work together for the greater good. The pharma industry needs to work with the hospitals and get the right level of partnership to come up with better drugs, right? So it's important, but it will be overseen by ethical committees, thought leaders in our ecosystem who will make sure that my data is not being used for somebody to make money. Yes, eventually they make money, but after they provide something to society that they make money, right? And that is happening fairly strongly. So, there will be exceptional cases where there are some violations, but in general, our doctors are very particular about it and they do a good job of it.
Great. Thank you very much. To conclude, because you can correct me, because there's no doubt this is going to be a very, very, very important field in the medical healthcare. And what we are seeing is only the beginning. Lots of things have to come as far as technology is concerned, as well as regulations are concerned, and the structure of the data is concerned. Okay, privacy is still there, but still, what level of privacy, what level of aggregator level, what all information has to go. I think this is very interesting field which is going to change the human healthcare, not only predictive for the individual, but for the community as such, and for the society as such. So we are all sure the doctors and everybody. In banking, there was a time when people used to say, because bankers used to use IT. Now there was a time when used to, 5 to 10 years back, used to say the IT will come with, they will also provide banking. Now it is already happening, IT is also providing banking. I don't know, there has to be going to be a very big connection between the IT, the startups and the healthcare. Let's hope that everything goes for good and for the humanity, and especially the real-time data and predictive analysis and predictive healthcare. Are you on this with this? So that, thank you very much for making a very interesting discussion, interesting panel discussion. Thank you very much for that.
Thank you so much, moderator and speakers, for highlighting the importance of data and analytics in healthcare. I now request our moderator, Shri Ajayan Kavungal, to present the memento to all the speakers.
Our panelists will be there. All of you can, during lunch, if you want to interact with them, they are all there.
We'll save the questions for the one-to-one networking. Thank you, Shri Gopinath Koteeswaran. Dr. Amrita George. Thank you, Dr. Amrita. Vandhana Rajendran. Thank you. Dr. Mohan. And now I invite Srimati Sumi P, Manager Kerala Startup Mission, to present the memento to our moderator, Shri Ajay. Thank you so much, Shri Ajayan Kavungal, for wonderfully moderating the session, for asking the right questions so that we could get the relevant answers. Thank you so much.